Quitting smoking is a very important action a person can take to increase their health and well-being. Smoking affects the body by basically affecting every organ in the body. From a cardiac standpoint, it can damage the blood vessels, which can then cause the blood vessels to become narrow, they thicken, and that in turn can lead to high blood pressure, risk for development of coronary artery disease, peripheral arterial disease, and stroke. From a lung standpoint, it can affect or damage the airway, which can then in turn lead to long-standing lung issues such as COPD, including chronic bronchitis and emphysema. It can worsen exacerbations of asthma, as well as increase your risk for lung cancer. In addition, it can affect other things such as fertility, bone health, oral health, including gum and tissue disease. It can diminish a person's overall health, which can lead to absenteeism from work or activities. Secondhand smoke has been shown to cause multiple health conditions such as development of diabetes, heart disease, stroke, high blood pressure, lung disease. They're not only affecting themselves, they are affecting those around them and for generations to come, and to maybe stop the habit that they are smoking, and it would benefit others in a positive way. When a smoker decides to quit in as little as a day, patient's blood pressure begins to decrease in a good way. In that time as well, the lung function begins to improve. Even after a year, a patient's risk for development of coronary artery disease can decrease by half. At 15 years of quitting smoking, patients have essentially the same risk of developing heart disease as patients who don't smoke. Roadblocks that people can hit when quitting smoking include fear of failure, being around others who can be triggers as far as quitting smoking, maybe those who continue to smoke. Other triggers may include stress or alcohol, lack of support, lack of access to health care. I encourage patients to pick a date and quit by that date as a goal. Successful strategies for people trying to quit smoking include pharmacological means such as nicotine replacement patches, gum. There are other medications such as Wellbutrin, Chantix. Non-pharmacological measures would just be to quit cold turkey, utilizing hypnotism, acupuncture. There are also resources out there for patients such as toll-free numbers like 1-800-QUIT-NOW. There are websites, apps on your phone, perhaps finding another family member or a friend who also smokes and working with them to quit smoking as well. That way you have an accountability partner, and then speaking to a healthcare professional for other advice. Parkview also has a smoking cessation program that I often offer to my patients who are wanting to quit smoking. You're not alone in this journey, and we like to help patients as far as trying to quit smoking and to let patients and let people live a long, healthy life for years to come.